And I realized that there is a big problem to access to healthcare, but not just talking to one-on-one. I'm a clinical psychologist myself. I know what it means to have that kind of relationship, but mainly to have a self-empowerment tool in my hands, available when I need it, to really train at the best of my abilities. Hey, my name is Emilio Goldenhersch. I'm CEO and co-founder of MindCo Health. We are a behavioral health virtual reality company, scaling one-on-one therapies and turning any smartphone into a virtual reality platform. We help employers and patients to change their behaviors, specifically stress management and smoking cessation. So we started a company 6 years ago, almost, back in Argentina. We are a group of 3 friends from kindergarten that we know each other since we are 3 years old. I'm a clinical psychologist, one of my co-founders is a biomedical engineer, and the third one is an expert in virtual reality production. And the reason why we started working on this is because personally I lost my father to mental health and addictions, and that made me realize that I wanted to be of service to the community. We started with smoking cessation because we realized that all the alternatives out there, NRTs or even counseling or even all the apps that are available, none of them are targeting the main component of smoking, which is the social learning. And that's only can be achieved with virtual reality technology. So we started a couple of years ago. We decided to run clinical trials and really prove that what we're doing is really valid from a medical standpoint. Today we have partners with the Stanford Tobacco team. Also we have 2 peer-reviewed journals. We are a part of the Tobacco State program where I am from in Cordoba, Argentina, and we continue to grow from there. Yes, during COVID we saw that smoking cessation was a thing, but we realized due to the demand of our customers that stress, anxiety, mental health overall was also very needed. So we decided to move and incorporate other verticals to our platform. Now we have a stress management program that is able to educate and train people in coping skills practically, emotionally, but also overall as a sequential behavioral health program embedded into these smartphone-based programs. So personally, I overcome a very hard situation. I lost my father due to this, and I realized that there is a big problem to access to healthcare, but not just talking to one-on-one. I'm a clinical psychologist myself. I know what it means to have that kind of relationship, but mainly to have a self-empowerment tool in my hands, available when I need it, to really train at the best of my abilities. And that's what I'm really focused on, delivering and providing access to a care delivery methodology that doesn't really need, at the beginning of it, an intervention from a clinician, that you can really incorporate in yourself and train yourself in a platform that gets you to the office of the therapist in VR, as if you would be talking to the therapist, and then gets you to practice or apply the information, the education that you got, also in the same aspect. So it's a kind of applied psychology component that every one of us should be able to access to, and that's what really drives me. Right now, we're working within the employee benefits industry, and we're doing it at the global level. So any multinational corporation that has headquarters in the US and has branches all over Latin America, Europe, or Asia, we can address and provide the same benefit to any employee anywhere in the world because of the characteristics of mobile VR. So what we are looking into the future is to becoming the best provider in terms of smoking cessation, stress management, nutrition management, sleep management, and covering the non-communicable diseases out there, but relying on the behaviors that are actually developing those diseases later on.